Within the ICU, we've sort of developed 3 different telemedicine services. One is sort of, I think, the one that most people would think about, which is our video and audio consultation with ED docs who refer us patients. So whenever a child comes to the emergency department at an outside hospital, if that child is critically ill, those ED physicians then make a call to us for the purpose of transfer. During that call, we get information so that we can give them recommendations for interventions, diagnostic testing, and stabilization before we receive the patient. What we've done is transform that phone call into a video call. There's a few major benefits of it. One, all of a sudden I get to establish a rapport with an ED physician that transfers patients, and we believe that that will result in improved communication that's centered around the patient in the future. Number 2, I now have the ability as an ICU physician to see the patient that I'm going to be accepting. I can then say, oh, they look a little bit sicker than I thought, or you know what, they don't look as sick, maybe you can keep them in your emergency department in their local community, and the sort of emotional effect of transferring them to the bigger children's hospital and ICU will be less overwhelming. Number 3, I also then make a formal introduction of myself to the patient and the family, which means, hey, I'm Dr. So-and-so, you're going to meet me when you get to our ICU. And we've followed up with parents to specifically ask, what has that meant to you? And they love that. They're overwhelmed, they're coming to the ICU, and just the fact that they will see a familiar face when they get to our hospital in 2 hours because they met me online is way more comforting than I ever could have expected. For those parents who are too busy taking care of other children at home, or have job commitments, or some other reasonable thing that keeps them away from their sick child, we have put this sort of video consultation service together where I and the bedside nurse get to meet with the mom or dad or both online. And we basically say, here's what we talked about on rounds today, here's what your child's going to be going through today from a diagnostic testing perspective, here are the treatments they're going to receive, do you have any questions? So it allows the parents to virtually participate on rounds when they would not have otherwise had that opportunity because life just happens. I sort of have a love-hate relationship with technology. I get texts all the time, and it can be overwhelming at times. It can take you away from the people you're interacting with. It can take you away from your patient situations, and we sort of live in a world where this is the reality right now. But the upside of it is that it also can connect people when those connections aren't there. And with improved relationships, I believe that patient care gets better. When I know somebody, I believe my communication about that patient is better. When they know me, they're more likely to question me and question my intervention on the patient. And I think that leads to better communication and better care ultimately for the patient. And what we're able to do with telemedicine is reestablish a relationship in a time where people are too busy to talk. And I love the fact that we have the ability to do that. And I think it ultimately will result in improved care. There are studies in adult critical care medicine and pediatric critical care medicine that shows that just this video consultation between the PICU doctor and the ED provider improves mortality on patients, improves complications, reduces costs, and reduces length of stay for hospitalization. And so there is a whole variety of reasons, I think, why people should use it. I think we have to sort of change behavior, and this is an easy way to get people to change because this is common in our day-to-day use of technologies.